So beginning today, millions of Americans will see health care premiums double, triple, or go even higher. And that's because Affordable Care Act subsidies have officially expired for Americans who purchased insurance through the ACA marketplace. And according to KFF, health insurance premiums are expected to skyrocket by 114% on average for more than 20 million Americans. These subsidies were a key sticking point during the longest government shutdown in history. And although Congress reached a deal to reopen the government, it did nothing to address these subsidies or the cost of insurance, leaving Americans to fend for themselves. Joining us now is Julia Appleby, a senior correspondent for KFF Health News. So, Julia, are people who have health insurance through the ACA already feeling the effects of the end of these subsidies? I mean, what kind of sticker shock are they actually looking at today?
You know, it's going to vary a lot depending on where somebody lives, their age, the plan they choose, that kind of thing. Just to be clear, these enhanced subsidies did go away on December 31st, but there are still subsidies. People still qualify for the subsidies that were there before these were enhanced. So basically, they're less generous, they're smaller, which is leading to the kind of sticker shock that you're seeing. So some people who might have had a plan that didn't cost them anything every month might be paying $30, $40, $80 a month, which could be substantial on the lower end of the income scale where those folks would land in terms of these subsidies. On the other end of the income scale, there's now a hard cap. There is no subsidy available for folks who earn more than 4 times the federal poverty level, which right now is about $62,600 for an individual and about $84,600 for a family. So folks above that level aren't getting any subsidies. And that's where you're also seeing people who are suddenly running into, $1,000 or more a month on top of what they were already paying. In fact, I got an email over the break of a couple in West Virginia. They're in their 50s. They've got two 22-year-olds who are on their plan. They make about $150,000 a year, so they're above that 400%. And their plan went to $4,000 a month, and that's with an $18,000 annual deductible. So that's a lot of money.
Yes, it is. I mean, we're all here in the studio counting the numbers and saying to ourselves, that is just, it's crazy. So what will happen to people who can't afford the new price of health insurance? If you're one of those 20 million individuals, what do you do?
I think what we're seeing people doing is they're signing up for different types of coverage. Maybe they're signing up for a bronze plan instead of a silver level plan. Remember, these come in sort of like Olympic medal colors. And the bronze plans have lower premiums than the silver plans, but they've got higher deductibles, on average around $7,000 a year. So we're seeing some people do that. Some people are going to not get covered at all. I think I think I've seen some estimates ranging from 2 million to 7 million people. Their experts are estimating might not sign up for coverage this year. So the uninsured rate will probably go up. We don't know yet. Some people are renewing their plans and hoping that Congress will act. And remember, they are going to be discussing healthcare again, and these subsidies will come up again. It's not inconceivable that there will be a debate. Whether or not anything gets passed in time is a question. Congress has about 10 days before January 15th when coverage for February 1st, people have to enroll by January 15th for coverage that starts February 1st. So something might happen with subsidies between then and now, but it's kind of a long shot. So people might be signing up, but will they pay their premiums in January? Will they pay their premiums in February? I think we really aren't going to know the impact in terms of how many people enroll and don't enroll until well into the spring.
Yeah, and that's just
how many people pay.
It's ridiculous in a country as rich as ours and hardworking people, not even signing up to get health insurance because they can't afford it. That is just straight up. That's just wrong. Senior correspondent for KFF Health News, Julia Appleby, thank you so much. I know this is something we'll be talking about a lot this year. Thank you.
Thanks for having me.